I'm Dr. Genevieve Milnes from Psychology Australia. In this session, I will be talking about Obsessive Compulsive Personality Disorder. Obsessive Compulsive Personality Disorder is a preoccupation with neatness, order, cleanliness and perfection to the expense of flexibility, openness and efficiency. While it is normal and healthy to want to have an ordered, clean and organised lifestyle, people with Obsessive Compulsive Personality Disorder, or OCD, become preoccupied with the details, rules, lists, schedules and order to the point where the activity is lost. Because they have such high standards, they are often unable to finish the task, or if they do, will become totally devoted to work to the exclusion of leisure. They become over-conscientious and inflexible about their rules for living and may extend these ideals beyond their religious affiliation and become rigid and stubborn. Unable to discard worn-out or worthless objects, they develop a miserly lifestyle that they impose upon themselves and others. They're very reluctant to delegate tasks to others unless they are able to do it in exactly the right way. Obsessive compulsive personality disorder is estimated to affect about 1% of the general population. When making this diagnosis, it is important not to confuse cultural behaviours with the condition. This personality trait can be valued in situations that reward high performance, such as for surgeons and pilots, but sometimes it becomes dysfunctional when they begin to cause personal and interpersonal distress. Rob presented at my psychological practice because his disorder was affecting his marriage as well as causing him considerable personal anguish. Rob was a highly sought after handyman because he would always do a near perfect job. However, when he took on a large project that was to take him and his business partner a couple of years, his disorder started to affect his relationships with his wife and his business partner. Unable to let go of details, he lost sight of the bigger picture. And even though he worked hard and long, he found it difficult to know when to finish a task. He worried about even the small and insignificant details that would not be noticed, struggled to allow even tradespersons to complete their jobs without interfering with them. Instead of buying new materials, even when they were cheap, Rob would insist on saving money by using older materials. Obsessive-compulsive personality disorder is difficult for others to live with, and his disorder began to affect his relationship with his business partner, who thought that you could be penny wise and pound foolish. As a result of his exhausting condition, his health and sense of well-being began to suffer. It was not until he was able to take a step back from the project that his relationships began to improve. If you think you or someone you care about might be suffering from OCD, then I recommend you have a chat with a psychologist because help is available. Thank you for listening. Remember, there's lots of free, helpful information and a range of online tests at the Psychology Australia website.